7-year-old Veronica Crespo has been learning how to count to 50 and how to write her own name. But like half the kids born with Down syndrome, she suffers from a congenital heart defect. So far, Veronica has had 2 open heart surgeries and is waiting for her third. Her father fears that if the Affordable Care Act is replaced, she will not be able to get the operation she so desperately needs.
She would die. Why? Because her heart and lungs would stop working, her heart would stop pumping blood and oxygen to her lungs, and lungs need that. And she needs the surgery to get these arteries that will help her heart work like it should. If she doesn't get the surgery in 1 year, she would die.
The Affordable Care Act has allowed Veronica to get 2 heart surgeries and provided her with physical and language therapy.
I think that these programs have helped Veronica immensely. And like Mr. Carlos has pointed out, she has been able to get many types of therapies from which she has benefited. And if they took these away from her or reduced the intensity of the programs, Veronica would suffer because they'd be limiting her development.
Republicans in the U.S. Congress have a new plan called the American Health Care Act, which still needs approval. They favored legislation that will give states more flexibility, especially when it comes to coverage of pre-existing conditions. Democrats say that the Republicans' new plan only helps the rich.
This isn't a health care bill. It's a tax cut bill for the super rich. That's what it is. And I don't like saying that. I wish that we were at a point where we're actually debating things that we could improve in our health care system.
According to the Joint Committee on Taxation, the American Health Care Act would bring a tax cut of at least $144 billion to those making more than $1 million a year over the next decade.
The CBO says that if the American Health Care Act is implemented, as many as 24 million people could lose coverage within the next decade.
It's something the Crespo family does not want to think about. Andrea Arenas, CGTN, Washington.